And good evening, everybody. Welcome back. It's another Sunday, another respect. Hope you all had a great week, even though I just saw you a couple of days ago. But I hope you're all doing well and you're stoked for tonight's show. You know, we've spent so much time over the past couple of years, pretty much so ever since COVID, but over the past couple of years, learning about the evils of big pharma and the medical community to begin with, and just all the stuff that's going on. We've got Maha now trying to turn things around and all kinds of new ways and new directions to heal. But right now, we're still kind of linked into the old ways, and we have to be, as it always was, our own best advocate. So occasionally, you run across somebody who's really got a wealth of knowledge in regard to this, who's in the medical community, but gets out there and helps to share that knowledge in a very clear and logical way. And so that brings us to tonight's guest, the lovely and talented BB MAGUIRE.
Hi,
Welcome.
everybody. Hi, Mark. Thanks for having me.
Oh, absolutely. It's my pleasure. So, like I said, we've got so much going on in the medical fields, but for people who don't know who BB MAGUIRE is, let's give them a little background.
Okay. Well, who is BB MAGUIRE? Well, she's kind of she's a short chick with a lot of opinions. But that's it. No, I'm kidding. I am a nurse, and I've been a nurse for approaching 35 years. I started in emergency trauma medicine. I did that for 22, 23 years, and then moved into surgical services. So I work in and around outpatient, mostly surgery. Currently, still working full time, and so I've had the opportunity of all of these years of experience. I've worked multiple different medical systems. When I started in nursing, good gracious, we weren't even wearing gloves to start IVs. So it was pre AIDS epidemic and the where we started using what we call universal precautions, where we're protecting ourselves against bodily fluids. So we didn't even start IVs wearing gloves when I started nursing. So it's been a little while, and things have changed a lot. When I started, most of the hospitals were independent, and now most of them are corporate conglomerate owned. Most physician practices were independent, and now most of them are owned by corporations and hospital systems. So medicine has changed dramatically just in the 35 years that I've been in it.
That seems to be the direction of a lot of things.
Hmm.
Medical field, my field, everything has just been gobbled up and incorporated.
Uh-huh.
Everything is now a business. And the problem is when your health and well-being becomes a business.
Well, that's
It's
the
like,
thing. Yeah, that's the thing I try to help people understand is that we as patients are still operating from the perspective that the provider that I'm engaging with has my best interest at heart, and that's not always the case. I'm not going to make a blanket statement about every medical provider, but in many cases, the provider that you're seeking care from is getting pressured from those above him or her to hit quarterly profit margins and volume expectations. And the procedure that you're being advised you need may not be because you need it. It might be because they need that number, which
that was
is
a big
just
problem.
honest.
That was a big problem during COVID because
Hmm.
if what we heard was true, they were getting paid for all kinds of things. For each person that went on an event, for each person that got remdesivir, for each person that they said had COVID, even if they died of a gunshot wound to the head. All of these different things that the hospitals got paid for.
Yep.
And when you
And then
deal
the
with
uh, the
issues
other
with,
thing I think that was really frightening, I think the most frightening part about COVID, all of that just lends itself to corruption. But the one that really, really, I think was the most, egregious was the PrEP Act. And what the PrEP Act did was, take away all liability for any COVID countermeasures. So they could give you Regeneron or Remdesivir, not Regeneron, Remdesivir, and completely annihilate your kidneys, send you into kidney failure, your lungs fill up with fluid, and then they go, "Oh, gee, this is so strange. I've never seen an upper respiratory virus cause kidney failure." That's because upper respiratory viruses don't cause kidney failure, but Remdesivir does. But you couldn't sue them for malpractice or for harm because remdesivir was considered a COVID countermeasure, and they were liability free for any COVID countermeasures. Yeah, not good, not good. The
And the
patient
key word in there
Hmm?
was the key word in there was were.
Yes, yes.
And I think there's going to be a hellfire storm coming up because when you said that you got into it pre-AIDS,
Mhm.
and when you think that little, the show's called Respect, I won't say it, that little twerp
The
was involved
gnome.
in that also, the gnome.
Yes, the gnome. Fauci the gnome.
You know, this is just generational evil,
Yes.
and this is what we were dealing with. And when you go and you use the medical field, which is supposed to be that of healing, but we know what the Rockefellers did decades ago.
Mhm.
But you have a field that's supposed to be taking care of people's health. And basically, we've all been human guinea pigs for decades. This is, we talked about what the Nazis did during World War II and experimentation on living patients. Look at what came here.
Oh, yeah. And they just continued. They just got better at concealment. They just got much better at concealment.
And, we all know that the phrase that we have to be our own advocates, but there's still a degree to which you have to depend on these quote
Mhm.
unquote medical experts to give you proper advice. And you really have to sit back nowadays and scratch your heads, especially, as you get to be a senior
Mhm.
and you go and you have to choose your doctors more carefully. And then you go through and you say, oh yeah, okay, here's WebMD, and they'll give you their educational background. And you go, oh, Jesus, do I really want to pick any of these people who were educated in Guadalajara or,
Mhm.
New Guinea or something like that? I want somebody who was trained here in the United States.
Mhm.
But again, like you said before, when hospitals became business centers and then bought out the doctors' practices, turning the doctors into nothing more than employees with time limits, the same cattle prod to their butts. You got to keep that door. If you're a surgeon, you got to keep that operating room door cycling, and you got,
Spinning. Yep.
yeah,
Not only
it's
that, but I think what happens too is that, when you talk to some of the physicians in, like, the health freedom movement, what they talk about that was so frustrating for them is that for forever, they were able to practice medicine, which meant, they could evaluate a patient and, "Hey, why don't we try," like, for instance, we're talking about COVID. We know how to treat acute respiratory distress syndrome, ARDS, and many times we treat it with a steroid to reduce the inflammation in the lungs. We have this massive inflammatory response that's occurring with COVID. Well, why don't we try corticosteroids? But because the hospital systems did not include that as part of the COVID protocol, doctors who operated outside of what a suit, on the top floor of the corporate-owned hospital told them they could use, they were outed, and they lost licenses, they lost jobs, they lost careers, they lost board certifications. It just was astounding, the fact that corporations were practicing medicine, not doctors.
Well,
And
see, but
and
this is
corporate medicine isn't interested in how well you do. Your outcome is meaningless because they're still gonna bill and get paid regardless of what your outcome is. They are not concerned in the least about how things turn out for you personally.
no, well, I mean, when look at it as an overall process, what is the biggest and most important asset of any corporation? It is their legal department.
Oh, yeah.
And all that these people have done is created a situation whereby they're pointing in every direction. It's not my fault. It's over here. This is what the WHO said. This is what,
Mhm,
the Department of Health says, and that we're following their protocols. So it's just a cycle of blames in different directions. And then when you throw in the fact that we weren't, keyword again, weren't allowed to sue for the damages that they did, you're the
mhm.
loser. You
Oh,
were the
yeah.
loser. I was still working uh, when they had the freezers full of people in Queens, some of whom were put in there still alive. Thank you, Mario Cuomo.
Oh,
And
well, that was actually it was what was happening in New York that actually woke me up because I had been I was in the medical matrix for decades. I believed that I should get a flu shot. I believed that I believed in all of it because I had been trained and brainwashed and the whole thing. And COVID woke me up, and the very specific moment was watching the news when hospital ships were sent to what was it, LA and New York, and they sat empty while ill nursing home patients were discharged out of the hospitals and back into nursing homes to allegedly make room for all of these sick people that needed hospital beds. And I remember thinking in that moment that this is really, really nefarious. They're going to infect all of these older people who are not going to do well, and they're killing off the old folks. They're killing off the old folks, and that's what woke me up. And when I woke up to the idea that they would lie to us about that, the next question for me was, what else are they lying to us about? And that question for the last 5 years for me just continues to grow. And it's essentially how, I got started, doing this to try to help people know the truth. Because as I began asking the question, what are they lying to us about? I thought I have to start telling people what I'm learning. Let me just share what I'm learning. I'm on a quest to learn what I've been lied to about. And I share that with other people.
you see, even bringing that up, having spent almost half a century in the mainstream media, when all of this crap started, and like you brought up, they sent the ship to New York. They took the Javits Center, which I forget the square footage of it, but the place is immense, and set it up as a hospital station. Um, I forget, Billy Graham's son went and set up Central Park.
Mhm.
They had tents out there and this and that and the other. The only place, including the hospitals and all of the stations, were sending reporters to each one of the hospitals around the city. The only place that was packed on an ongoing basis was Elmhurst Hospital.
Mhm. Well,
That's where they
I have an interesting story about Elmhurst because, when I woke up, I, started seeking, right? I'm seeking. There was a physician that I worked with for a long time, ER physician. We taught advanced cardiac life support together for, gosh, probably 10 to 12 years. Anyway, this physician came out of retirement. He's originally from New York. He came out of retirement to go help. And so he was working in the ER at Elmhurst at the height of the pandemic. And we did a Zoom call. It was, I don't know, 5 or 6 of us on this Zoom call, and he was just kind of updating us on what he was seeing. And what he shared with us was that, he said, "Geez, I'm intubating," which means putting a tube down. "I'm intubating 12, 14 people a shift. And we're going, holy cow, right? And then he went on to further explain, and I'll walk you guys through this. So he said, I said, well, are they really that sick? I mean, what's going on? He explained that because at the time we didn't know the transmissibility of the COVID vaccine. We didn't know if it was droplets or if it was airborne. We didn't know. So when you come into the emergency room generally and you're short of breath, they put that little thing on your finger. It's a pulse ox, and we get what's called an oxygen saturation. Like how saturated are the red blood cells in your capillary bed with oxygen? And we get a number. Well, what was happening is if you came into the ER and they put you on the little prong nasal cannula oxygen, if you couldn't maintain your oxygen saturations at a decent level with the nasal cannula, in normal situations, the next respiratory adjunct that we would use is called a non-rebreather mask. And it's a mask that goes over your face, and it has this bag. It's called a reservoir. And when you turn the oxygen up using that mask, you can get somebody up to 100% oxygen. The problem with using the non-rebreather is that on the mask, it has these little portholes. So when you exhale, it would be exhaled out of those little portholes into the room. And so if you couldn't maintain your oxygen saturation on the little prongs, the nasal cannula, they immediately intubated you because they did not want to put you on the non-rebreather mask to protect the providers. Well, once you go on a ventilator, now you've opened up an entire plethora of secondary issues that could take you out. You're bypassing your natural airway. You're more prone to infections and all. I could talk for hours on what happens when you go on a ventilator. It's not good. And so a lot of that was as a result of protecting healthcare providers out of their own fear rather than what was best for you. Because I've interviewed Pierre Corey, and what he explained that he saw a lot during COVID was what they called happy hypoxia, which means your oxygen levels are low, but you're not in distress. But all they were looking at was a number rather than looking at the patient. If your number was this number on the nasal cannula, then you needed a ventilator. And that's why so many people were intubated and put on ventilators, and we had a shortage. It wasn't because people were sick enough to need ventilators. It's because healthcare providers, at least the ones at Elmhurst, were protecting themselves. That was the report that I got at the height of COVID.
That's just mind-boggling.
Yeah.
I mean, as a nurse, one of the things that has driven me crazy, and it's not to the extent of people who had to be put on vents or anything else, but during the process and during the 2 bad years of COVID, the alleged virus, when you go to a doctor's office, if a doctor would see you, because most of the time they wouldn't. Of course, you had to come in an underwater tank suit and the whole bit, but you had the mask on. They'd leave you sitting in the waiting room with a mask on. They'd take you back into the examining room. You'd sit there with a mask on until the doctor finally came in. So you're sitting for maybe 15, 20, 25 minutes wearing a mask. And then the tech would come in and put the probe on your finger and go, your oxygen level is low. My first response was, are you a medical professional? I'm sitting here inhaling CO2 for half an hour, and you're going to tell me my oxygen level is low? I think you've been wearing the mask too long.
Exactly.
And most people just plain didn't get it. And even the doctors in private practice were not putting 2 and 2 together.
Well, it's astounding to me. I mean, I'm a nurse. I'm not an expert. I'm just a logical critical thinker because I was trained to be a critical thinker. I'm a critical care nurse. And so, something as simple as the paper surgical masks. Every single medical provider understands that a surgical mask is worn in surgery, and it's worn in surgery for one reason only: to stop droplets. If you have a mask on and you sneeze over a sterile field, then your droplets are not going to contaminate the sterile field. That's why we wear a surgical mask in surgery. Surgical masks have very large openings. They are not designed in any way, shape, or form to filter what's going out or what's coming in. And yet, doctors insisted upon people wearing a mask that they knew did not filter. It's like I don't understand the psychology that occurred. I don't understand the psychology that you can take people who critically think for a living and that gets turned off like a switch. Because they just would adamantly fight you on it. And then the other thing that I loved during COVID was the KN95s. I still see people wearing them. Okay, let's talk about N95 masks. So N95s in outside of medicine, N95 masks are mandated by OSHA if you work in construction and you're doing any kind of work with concrete, silica dust. You're required to wear an N95 mask because it filters that fine particle dust, right? In medicine, we use N95 masks if you were going into a room with an airborne illness, like, say, for instance, tuberculosis. It's airborne. And so, in order for me to walk into the room of a tuberculosis patient who has an infectious disease that's airborne, I have to be fit tested. And what fit testing means is that they have to size this mask to your face. So if you're a man, you can't have any facial hair. You can't have a beard. You can't have a mustache because this mask has to be fit tested and tight around your face to create a seal. And the way they test the seal, they put a hood over your head while you're wearing the mask and they spray this bitter stuff into the mask. If you can taste the bitter, it means that it has gotten through the mask and has landed on your tongue so that you taste it. That means that mask is not going to protect you from an airborne illness like tuberculosis. You need a different size. Yet, I'm supposed to walk into the room of we don't know if it's airborne, we don't know how it's transmitted COVID thing, wearing this fake KN95 stuff made in China. God only knows what kind of chemicals were in those masks that we were breathing directly into our respiratory tract hour after hour after hour with gaping holes all around it. And then I see people wear these masks. They'll come into the center that I work at. They will wear these masks for weeks. I'm looking at this mask going, this is a microbiology experiment right here. Because what people don't understand is when you exhale, it's warm and it's moist and then it's trapped. And bacteria love a warm, moist environment. They proliferate in that environment. And so now you've got potentially a petri dish full of bacteria that you have over your nose and your mouth, inhaling directly into your lung. And a cursory search about the 1917, 1918 Spanish flu, people didn't die from the flu. They died from secondary bacterial pneumonia from wearing masks, homemade cloth masks that were nothing but a bacterial petri dish.
And especially if they're wearing it, not just normal inhale, exhale, but if they sneeze or if they cough,
Mm-hmm.
now you're trapping those germs in there.
Yeah.
And where are they going to go? And how many people didn't even bother to change their mask from day to day?
Yeah. I didn't wear a mask more than 2 hours before I was changing it. And that was difficult in the beginning because, we had, the PPE shortages. because we had outsourced so much of our supplies. I can tell you on a daily basis, because I've started to pay attention in the course of my day. If I look at the supplies that I use, I'm opening up, the IV tubing. I'm opening up that IV bag. I'm using this IV catheter. Through the course of my day, the equipment, the supplies that I use, I would say probably 99% of them are made in China.
Which
So
in and
we
of
are
itself is
completely
scary.
dependent upon China to provide us with the supplies that we need to take care of you.
And how many of the pharmaceutical companies
Yeah.
have outsourced their stuff
Mhm.
to there?
Well, it's interesting too, because if you even look at like companies that are trying to do things like here in the United States, like for instance, I think we're up to, I don't remember. I don't want to say a specific number in case I'm not correct, but there's a number of states that have allowed ivermectin to be sold over the counter now, right? They've passed legislation. And so if you talk to those pharmacies, because I think the first state that did it was Tennessee, and I had actually spoken to two pharmacies in Tennessee because I was curious, and I called them and I said, I'm just curious. I understand you guys are compounding ivermectin there at your pharmacy. Where are you sourcing it? And every time I called to ask, the ivermectin was not being sourced in the United States. It's being sourced from India and China, primarily India, but they were just compounding it into tablet form in the United States, increasing the price and selling it to us. So, yeah, even ivermectin is there. Most of it isn't sourced here in the United States, and even naturopathic products. They try to source as much as they can in the United States, but a lot of it has to be globally sourced because
Well, this
so
is
much has been outsourced.
this is one of the things, and we're going to get into that topic in a little bit, but with Maha,
Hmm.
when you look at stuff that's been outsourced, and even just simple stuff, a loaf of bread, a box of cereal, and you look at the ingredients list on the side of cornflakes, and the list is this long.
Hmm. You don't
And you
even know what
go,
it is.
yeah, I mean, most of it is chemicals. And
Hmm.
then you go to Europe, and the list is 4 items. You have to
Hmm.
say to yourself, what have we allowed them to do? And why have we allowed them to do this? Again, going back to being your own advocate, people
Well, I
can't
think
be
we're
bothered.
I think we're actually awake to it now, though. You know what I mean? I think we're awake to it. I know that, I think about like, because I'm going to be 60 in a couple months. And so what was it like in my 30s when my kids were younger, and I'm going to the grocery store and I'm buying their cereal and getting their stuff for their lunchbox, and you know did I have any reason back then to question whether or not what I was buying and feeding my children was harming them? I had no reason to question any of it. Now, I'm sure there were some people, small percentage of people that maybe saw that stuff wasn't good, but I think the majority of us, we had no reason to question that the food that we were buying was harmful. And so, the wake up that is occurring, I think, is phenomenal. And even if we just, start looking at the way things changed, it almost looks coordinated, because food pyramid stuff changes at the same time. We're told to eat. For instance, when Trump and RFK came out, and they talked about Tylenol and autism, and they talked about the the f- the folate receptors on the blood brain barrier, and Tylenol. And I'm kind of looking at this sideways like this. I came right up against my own cognitive dissonance. We all have it, even when we think we're awake. There's still more to learn. There's still ways that we're going to buck up against a firmly held belief that we have to step back and go, maybe I had that wrong. Because I'm looking sideways at this going, are you kidding me? It's Tylenol. I mean, that's the one thing I would think I could tell people that it's safe to take. What in the hell are y'all talking about? But I went digging, which in and of itself is something I have not seen very many medical professionals do. Even at work last week, I mentioned, the whole Tylenol thing. Did you watch the Tylenol thing? Yeah. Did 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 you look into why? Well, no. Okay. So anyway, back to the Tylenol. So here's the thing. In a very short time frame, a matter of just a couple of years between the following things, they all kind of occurred together. So we were told that Reye's syndrome was caused by aspirin. And the FDA put warning labels on aspirin and told everybody to take Tylenol instead. Stop using aspirin. It can cause Reye's syndrome. Even though the year that the FDA put that warning on aspirin, there was only 88 cases of Reye's syndrome in the entire country that year. And not all of them were actually affiliated with aspirin. So it's not a cause, it's just a correlation. And 88 cases. So they moved everybody to Tylenol. At the same time, like within years, just a couple of years of each other, they changed the food pyramid. And they told us that we needed to eat 6 to 12 servings of grain. At the same time, they told us that folic acid deficiency causes spina bifida. So all the pregnant ladies were told you need to take folic acid. I took folic acid, pregnant with my children. Lots of women have. Got to take your folic acid. Well, none of us thought that folic acid was something synthetic that might be harmful. It's a vitamin, right? Okay, stay with me. At the same time all of that is happening, they identify a gene mutation. It's called the MTHFR gene. And this
I'm sorry,
gene
what is that?
mutation, it's called, yes, the MFR gene, MTHFR. And when they identified this gene, they found out that like 40 to 70% of the country has it. What's important about that? Well, if you have this gene mutation, you lack the master antioxidant glutathione. What does that mean? It means you can't clear toxins. So toxins build up in your body, they build up in your brain. You can't clear them if you have this gene mutation. You're low on glutathione. Well, what happens if you take Tylenol? Well, Tylenol lowers glutathione. And when Tylenol is metabolized in your liver, it creates this toxic metabolite called NAPQI, NAPQI. So you've lowered your glutathione. You're already low in glutathione. So now you can't clear this toxic metabolite. On top of that, folic acid that is now sprayed on all of our grains that we're eating 6 to 12 servings of, that we're taking because we're pregnant, right? Folic acid requires glutathione in the liver to be broken down into folate. We have folate receptors, which is natural vitamin B9. We don't have folic acid receptors. Folic acid has to be broken down. We can't break it down if we don't have glutathione. Well, if you can't break it down, then it builds up. So now you're folate deficient and you have a whole bunch of folic acid running around in your body that can't be broken down. And when you start looking at the disease processes that scenario results in, it looks like Alzheimer's, it looks like dementia, it looks like autism and ADD. It looks like mood disorders. It looks like migraine headaches. It looks like an increase in stroke and cardiovascular disease. I mean, it is massive. If you guys take away anything, go to an AI tonight and type in, how could too much folic acid hurt me? And just look at that because it'll boggle your mind. So just for the record, I've suffered from migraines since I was like 8. I went and had my blood work done to test for that gene. I'm waiting on results. I'll let you know. Because if I have it, I need to cut out folic acid out of my diet. And when you look at like labels of anything, like my husband, I was at the grocery store. My husband ran off to this other store. He wanted to get his favorite peanut butter pretzels, right? He's running up. He said, well, I couldn't find them. They didn't have any, but I got these other pretzels. And he said, this one was the only one that didn't have enriched flour. So if you look on the back of any label of your crackers, anything with a grain, pretzels or chips or bread or anything, cereal, any grain, if it says enriched flour, then it has been sprayed with folic acid. Yeah,
That's
decades. This has been going on for decades, and we wonder why we're sick.
But that's the whole thing. I mean, when you think back on the way that the directions they've taken us, especially with food, and the changes in the health processes. You look back to decades ago when they wanted people to, especially heavy people, to cut back on sugar, and they gave you those tiny little saccharin tablets.
Mm-hmm.
Poison.
Oh, yeah.
Then you had sweet and low, which was saccharin. Then, your cholesterol is getting too high because you're eating the wrong foods. Got to stay away from butter. So they gave you margarine, which was
Lie after
hydrogenated oil.
lie
Which,
after lie.
yeah, I mean, there's tests that they've shown with hydrogenated oils, you could hold a candle to it and that stuff will not melt.
Mm-hmm.
So all of these different things that they've thrown at us over the years. I mean, I always used to refer to my wife as the hydrogenated oil police. And she found hydrogenated oil in Caltrate. What
Oh,
the hell is that doing in a calcium supplement?
it but if you think about it and you step back and you go, okay, what's downstream from all of this? Well, it's chronic illness that's not enough to kill us, but enough to make us sick that we are seeking pharmaceutical solutions, right? Because the pharmaceuticals have I mean, I defy anybody to tell me what disease has been cured by a pharmaceutical. They don't cure anything. All they do is manage symptoms. The disease process continues to evolve and continues to degrade you. The disease continues, but your symptoms are managed a little better with the pharmaceutical. They're not helping you. They're just prolonging the inevitable. And and you seek out the pharmaceutical to manage the symptoms without getting any kind of a cure because all of it was to make us chronically ill where we would be seeking all of these different products. And over time, that's what's made the pharmaceutical companies massively rich. So like you were talking about the oil, right? So we get corn subsidies which helps, get the oils going, the corn oil and the high fructose corn syrup and then big food is working in conjunction with big pharma to basically put all this crap in our food. Big food makes a lot of money and then on the back end big pharma makes a lot of money when we get sick from all the crap that big food put in our food. It really is sick. It's a sick, twisted. And once you see the totality of that, it can be a little overwhelming. It was for me, waking up to this. I'm like, how do we take back control of our health when we've got all of this against us? And so for me, I try to keep it simple and I just try to make one better decision at a time. If I'm gonna make hamburgers for dinner, I'm gonna make hamburgers. So how about if I choose this ground beef rather than that one and this bread rather than that one? I'm still gonna eat the hamburger, but I can eat it in a healthier way by just making one better choice.
No, and that's what you have to do. But it also lends itself right now. Everybody's on the organic kick. And everybody's got an organic this, that, or the other.
Mhm.
But the first thing I said to myself with organic is, okay, they're not being sprayed with the chemicals. Who's testing the soil that they're being grown
Exactly.
in? Who's
Exactly.
testing the water that they're being watered with?
Yep.
And all of these things that people, again, it's the brainwashing that people sit and they think about in simplistic forms. Don't give it a second thought because it's organic, it's natural. TV says it's healthy.
Mhm.
BS.
Yep.
BS. And this goes back to, again, becoming your own advocate. Now, I've seen all the stuff that, Secretary Kennedy's tried to do
Mhm.
and all the pushback.
Oh, they just want to destroy his credibility.
Oh, absolutely.
Mhm.
Absolutely. And
Because if they can destroy his credibility, then they water down and make, meaningless his message and the data that he's putting out and the direction he's trying to take us and the reforms that he's trying to put into place. If they can destroy his credibility, then they water down everything else. It's not working. It's not working
no, well, I mean,
because
look at the basics. Just look at the numbers. From when I was a kid to now, I think I got um I don't even remember. I know I got a polio shot. Above and beyond that, I know I had measles. I had German measles. I had everything except the mumps. Still here.
Mhm.
I know I played in the dirt. I fell and I cut myself. Did all kinds of things. Still here.
Well, the one thing that I the here's the simple question that I ask folks. We are so hyper focused on preventing viral illnesses because everything that you just mentioned is a virus. We're so hyper focused on vaccines to prevent viral illnesses. And my question is, what viral illness has wiped out the Amish community that does not vaccinate? None of them. Mumps has not wiped out the Amish. Measles hasn't wiped out the Amish. I had chickenpox. I had measles. I had mumps as a kid. I had all of them. Developed natural immunity. But today, they've convinced everyone that they need to be deathly afraid of these contagious diseases that we all had as kids. I loved the mumps. That was the funnest thing ever. I had a little fever. I ate a lot of ice cream and I watched all the daytime cartoons. It was fantastic. I loved having the mumps. Chicken pox was not comfortable because it was itchy, but mumps, no problem. It was just, side of your face got a little swelled up and you ate a lot of ice cream. It was great. It was great. But now they got everybody scared to death. Oh my God. Oh my God. I have to give my child 18 shots full of neurotoxins. So, the side of their face doesn't swell up and they eat ice cream for a day. Are
And
you
that's the
kidding
day
me?
they're born.
Yeah. Yeah. That's going
That's
to change. That's
and
definitely going to change.
but the fact happens to be, and I guess it's everything was all timed in a way. Because when you look at the fact that going from when I was a kid to now, you had usually your father was working, your mother was home, you still had a home, you still had food on the table, you had clothes on your back, you went to college, you had cars, and they
Mhm.
retired.
Mhm.
But they made it to the point where now both parents have to be working and they're barely making ends meet. So nobody's paying attention to the kids. They're feeding the kids all this stuff in their foods. They're giving them all these shots. And look at how many cases of
Mm.
autism
Mhm.
you have, ADHD, ADD. And these kids are on all kinds of medicines for this stuff, and they don't need to be.
Mhm.
And immediately, rather than trying to find what the root cause actually happens to be,
They don't wanna know the root cause because then
you
they might
know,
actually, like, be able to cure it, and then how you know, Robert F. Kennedy, I watched a video clip of him saying that the most, how did he word it? The best asset for a pharmaceutical company in the United States is a sick child, because that's a cash cow for life. And I'll give you a real world example. Um, Last week, we had a young lady. She was in her 20s, early 20s, under the age of 25. We were removing her gallbladder. Red flag number one. How much metabolic disease is an under 25-year-old adult suffering from, that now she's got organs failing her that we have to remove? She was on medicine for cholesterol. She was on medicine for blood pressure. She was on medicine for anxiety and depression. And she was at least 80 pounds overweight. And she hadn't even hit 25 yet. And I'm looking at this going, she's not going to see 40 at the rate she's going. It's unheard of. Uh, 10 years ago, this was not happening. We were not doing this just 10 years ago. I'm seeing it increase at almost exponential rates. And there's something going on with the gallbladders. We are seeing a lot of gallbladder disease. I don't know what it is, but I feel like it's really increased.
I think a lot
There's
of it may be related to the foods.
the
I
foods.
mean, I don't recommend it to anybody, but you go to Disney World and watch what's waddling around the park.
Yeah.
You know,
Yeah. We didn't have this in the 70s. We
no,
did not have this.
you had obese people. I mean, I remember back in the 80s, how many stories we we did in New York of people that they had to cut out of their homes because they were so morbidly obese they couldn't even get themselves out of bed. And yet I never understood. Obviously, if they couldn't get out of bed, somebody had to be feeding them.
Exactly. Who's the enabler?
Yeah. So where's the tough love? You want to
Uh-huh.
eat? There's food in the kitchen. Get your ass out of bed.
Uh-huh.
But it has become an epidemic, and all of these things, like the Rolling Stones said back in '65, they got the mother's little helper. You
Yeah.
know,
Well, you talked about, the Rockefeller medicine and then the Nazi scientists that were brought over. And, it makes me think about, like, do you remember back when big tobacco got nailed because of I forget what it was, but essentially they broke them all up. And a lot of those tobacco scientists that had made cigarettes so addictive by adding all of these chemicals in the tobacco, because it wasn't just the addiction to nicotine, it was all the chemicals that were also put into a cigarette that made it ultra addictive. Well, they all moved to companies like they left Philip Morris and they moved over to Reynolds Food. And they just applied the same scientific principles to food products, to ultra processed food products, to make them highly addictive. How many times have you stuck your hand in a bag of Doritos and you're just going to eat one or two, and the next thing you know, half the bag is gone? You know, I myself have gone through an entire box of Ho-Hos by myself because I just kept eating them. I can eat an entire box of Ho-Hos and I'm like 5'2" and I weigh 110 pounds, because they're so addictive. I don't do that anymore, but I confess that, yes, I've eaten an entire box of Ho-Hos in one sitting because they did this is what they did. They made it addictive, and we didn't know. We didn't know. We didn't know that they had done this to our food.
and
You
yet,
know, because even I've looked at things like, some people our age will say, well, I grew up eating McDonald's French fries. I turned out okay. What's the big deal? Well, if you look at what McDonald's French fries were in 1982, it was potatoes and salt, and it was beef tallow. Now you look at the ingredients of a McDonald's French fry, and it is a whole lot more than just potatoes, and it's fried in highly inflammatory seed oils that are inflaming everything in your body and making you sick and messing up your insulin resistance, and then you can't lose weight. I mean, it just goes on and on and on. So what we were eating, a McDonald's French fry in 1982, is not what we're eating today. And why is that? I just saw today that Walmart, it just hit with shelves on Walmart. Walmart made a decision in conjunction with the whole MAHA to remove artificial dyes from their products in the stores. So the things like that the kids love, like fruit roll-ups, and there's another one, I can't think of it right now, but like the fruit roll-ups, now they are made without the artificial dyes that lend to behavioral problems and hyperactivity disorder and all kinds of other endocrine disorders, all kinds of stuff with the dyes. They're made with, like, carrot and beet, and the price is exactly the same as the ones with the artificial dyes. So if they could have done this all along and it not cost any more, then why were you ever doing it in the first place? Because you sold it in Europe without all those artificial dyes. Why did you do it here? What was the incentive? It was to make us sick and dependent on pharmaceuticals.
Yep. And that's the sickening part of the whole thing. And that's the part that people need to wake up to. They have to sit and understand and look and not fight the premise that these people were just plain evil. And this is what our medical community, this is what our pharmaceutical community, and this is what our political community have been doing to us. And then being pushed, of course, by the mainstream media. But all of this ties in together. And so many people have been so brainwashed to believe just what they're told because they are too lazy to just grab this and look it up, ask Grok or Google AI or anything.
I think the AI, the AI definitely is a game changer. And I know a lot of people are afraid of it, but for those of us that were around when, AOL dial-up internet started, everybody was convinced that the internet was going to take over the world. All the same things that they're saying about AI, they were talking about when the internet first started. And so, we got past that. And I think that AI is going to be a game changer from a medical perspective. I don't know other arenas because it's not my lane, but I think in medicine, it's going to be huge, and we have it available to us. So if you don't understand something, or you don't know, well, I don't even know where to start to look that up, well, just throw it into AI and ask AI, because and I, particularly with Grok, there's a lot of different AIs out there, but what I like about Grok is Grok talks to me like the ding dong that I am. Grok makes it real simple. It takes really complex stuff and breaks it down into something simple and easy to understand. And it's a great resource for anyone who is trying to understand what's happening. How can I make a better choice? How do I look that up? Utilize AI. It's available. It's right there. Most of them are free. We just have to be able to utilize it. I think, though, that I don't know. Here's what I've encountered with a lot of folks. When we start to talk about the totality of all of this deception that we just kind of reviewed, and that's just, cursory, I think it becomes overwhelming. And here's something that I've heard said in chats and in conversations numerous times. Well, 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 shit, they're poisoning everything. I mean, why even try? I'm gonna die of something because they're poisoning me. They're poisoning the air. They're poisoning the water. They're poisoning the food. They're poisoning the medicines. How am I supposed to fight back from this? And they give up. So again, I try to just keep it real simple. Okay, you're right. It can be overwhelming. So how about this one decision that's sitting in front of you right now? Like, which hamburger roll are you going to get? Well, let's choose the one that has less dangerous additives. Let's minimize how much toxins we're putting in because God made this amazing system, this amazing body that will clear and detox the stuff that's coming at it. But it can't if you're steadily putting more in. So if we can minimize how much we put in, then we might give our bodies a fighting chance of clearing some of it so we can minimize the long-term effects and the chronic illness, one better decision at a time. And I think that that's the key. And sometimes it means you might need a little help. You might need an app. There's several of them out there where you can scan the barcode and it'll tell you, oh, this one has a score of this. One of them is Yucca. I love the Yucca app. I used it at the grocery store today. I'm trying to buy. You know what I found out today? Here, I'll tell you. You can't buy tartar sauce that isn't poison. I wanted to find tartar sauce. Every tartar sauce is filled with crap. So I'm like, okay, I can make my own tartar sauce. So if I buy the good mayonnaise that's got avocado oil instead of the corn or canola oil, well, all I need now are some sweet relish or some sweet pickles. I could not find sweet relish that didn't have dyes and crap all in it. And then even just trying to find sweet pickles. So I found one brand that wasn't using an artificial dye. They dye the pickles. They dye the pickles with yellow dye 5, which is horrendous. And I'm like, I can't even buy a pickle. It's like, I just want to make tartar sauce. This is crazy. Yeah. Yeah.
It's in everything. It's in everything. And I mean, look,
But
I love,
I'm out there trying. I'm out there trying, Mark.
yeah, I love tomatoes and tomato sauce and this and that and the other. 23 and 24, I had back-to-back years of diverticulitis, 2
Ooh,
hospital stays, 2 holes in the colon,
ugh.
and thankfully didn't need surgery. But you go to the store, and what do they make? Something called Simply Ragu. It's tomato puree and I think 7 or 8 spices there. It's a total of 8 ingredients
Perfect.
and nothing bad in it. No seeds.
Perfect.
If you look, it's there.
It's there. You just have to take the time. Yeah. You have to just take the time and utilize the tools that we have today. I think about the fact that I'm glad that I've become aware in an age where, yeah, we have this tool available to us, right? Where we can utilize it. I can't imagine trying to do this like when my kids, like 10 years ago, 15 years ago, where I didn't have that kind of availability. I don't know what it would have been like. It would have been difficult, you know? We didn't have a choice. Today we
Well,
have choices.
we wouldn't be where we are now in this movement and all the things that we know if it hadn't been for the internet.
Exactly. You're
You know?
absolutely right. But we were deathly afraid of it, remember?
Oh, absolutely. I
So
remember
I wa
Y2K very.
Oh yeah. Oh yeah. Well, I do want to tell you guys, one of the things that recently had people's hair on fire was President Trump's annual exam report. And in there were 2 paragraphs that got everybody's attention. And the medical freedom folks, the Maha light, I guess I'll call them, their hair was on fire. Oh my God, President Trump's got Albert Bourla from Pfizer in the Oval Office, and now he's saying he took the mRNA booster and the flu shot. And okay, so let's address the flu and the COVID. When you read the wording in that press release, because that's what it was a press release, it says flu immunization and an updated COVID-19 booster. It didn't say the word vaccine at all. So those press releases are highly curated for public release. And the White House Medical Unit falls under the Department of Defense, or the Department of War now. The physician that examined him actually works for the Navy. His exam was done at Walter Reed. This is all Department of Defense. Well, if you think about strategically, you're not going to tell your adversaries exactly what the President of the United States received, because that would key them in, particularly right before he leaves to go to the Middle East for the peace deal, exactly what that man got or didn't get. Because the word immunization in the DoD can mean he got an immune modulatory substance. For instance, ivermectin or hydroxychloroquine fall under that, or zinc, vitamin C, vitamin D, all immune modulatory. And that can be considered an immunization. And a booster for COVID can include something like antibody therapy, like Regeneron. It doesn't mean he got a COVID vaccine. So, what the wording means is completely dependent upon what your security clearance is, because what is released to us is not what is reserved.
I think
For
that's a big part of people not understanding, no matter how many times we say it, that this is a military operation.
Correct. And the
And
other thing that I found really super interesting in that is that they talked about his EKG. I don't know if you remember, they said that his cardiac age was 14 years younger than his chronological age. So I'm reading this and I'm going, his cardiac age is 14 years younger than his age via ECG, interchangeable with EKG. And I kept reading it and kept reading. I'm like, wait a minute. I've done thousands of EKGs in my career. I read EKGs. I've taught EKGs. I've never been able to determine what your cardiac age is based on looking at your EKG. I can tell you whether or not you're having a heart attack. I can tell you whether or not you got a left bundle branch block in your ventricle, but I can't tell you what your cardiac age is. What are they talking about? So I went digging. What they used on the President of the United States, which is unprecedented, is AI diagnostics via his EKG, because they've been training at the Mayo Clinic. They've been training AI systems on millions of EKGs. So they feed EKGs into these AI systems and have them grab all those data points, all those data points, all those data points. And now what they found is that they can determine how old you are chronologically by looking at your EKG and looking at the minute, teeny tiny little minute electrical changes that only an AI can pick up on, that the human eye cannot. And from that, they can determine what your cardiac age is versus your chronological age. Now, what are the implications of this? The implications are that you could have an EKG, and they can predict overt cardiac disease decades before it actually happens. So you can have an EKG at the age of 35, and they can start picking up on, hey, there's this little minor thing and this minor thing, and they can predict that you potentially would be having a heart attack at the age of 50. So you could start to make changes in lifestyle, diet, exercise, all the things that we know to do, right? To prevent that heart attack that you would have no idea that was waiting for you. at the age of 30 or 35.
Wow.
It's fascinating. And the fact that they're doing this on the president of the United States, unprecedented. This has never been done before. And that tells me that the AI is much further along from a diagnostic perspective than I ever thought. If they're going to use it and come up with this diagnostic thing for the president, it's much further along than I believed it was. And if diagnostics are that far along, then where are treatments? How far along are AI guided treatments that potentially would be able to help so many of us? I was shocked by that whole thing. So if the president of the United States is using AI to help diagnose his cardiac age, I can use AI to look up, spaghetti sauce, right?
Now, I mean, is it advanced enough? Because heart attacks and cardio blockages, et cetera, arterial blockages are things that are pretty common. But is it advanced enough, which is, the silent killer, that it could pick up widowmakers and things like that?
Well, yes, based on what I looked up, you would see the electrical conduction changes happening in that heart muscle as that vessel just began to start to have disease, because it's a continuum, right? So you don't just all of a sudden have a complete blockage of your left anterior descending artery that causes a widowmaker. It doesn't just happen. It's a chronic buildup in that vessel that ultimately causes a blockage, and you have that massive heart attack. Well, what if they picked up on that 15 years before that widowmaker event and said, "Hey, you might want to make some changes because you've got some disease beginning." That might not have to be the outcome. You could literally change course. And if it's that far along with diagnostics, again, I keep thinking, well, gee, are we getting ready to find out that we are much further along in treatment as well? I don't know. I don't know, but I'm excited about it. It makes me hopeful that the whole idea that we feel so overwhelmed by all of the stuff coming at us that's trying to make us ill, I have hope that there's answers too. But, I'm going to
Well,
stay in hope.
I think that that's part of what people are looking at, because we've had so much misinformation
Mhm.
thrown at us during this psychological operation that you really don't know what to truly believe. And there's a lot of, as the phrase goes, hopium out there.
Oh yeah.
We all hope that there is such a thing as a med bed. We all hope that they have these advances in frequency healing, et cetera, et cetera. But like everything else, because we're not part of the 10
Mhm.
who know, we don't know.
We don't.
And we're not supposed to know until it's time for us to know.
Mhm.
So at that point, you can hope and just technologically believe that we're advanced enough to have certain things like that and be able to cure diseases that have been around for a long time. I laugh every time I see you know, a, an American Cancer Society ad
Ugh.
and asking you to donate. I mean, these
Ugh.
people have been around since the mid '60s, taking
Started
probably
by
billions of dollars.
Rockefeller,
That's right.
because his medications were causing cancer, and he knew it. So he started the American Cancer. Ugh. Ugh.
And
Yeah.
we've cured what?
Nothing. Nothing.
But we have a lot of people working on it.
Oh yeah, we're all working really hard. We're
And
working
I'd love
really
to know
hard.
how many people have been taken out because they actually did find the cure.
Oh, I wouldn't surprise me at all. I mean, the billions of dollars that they make off cancer alone, just alone. Yeah, it's personal for me. My stepbrother died just a couple of months ago in his 40s from melanoma, and and he was afraid. He was afraid to try alternate therapies that we now know. I'm just gonna say it, it's ivermectin. Ivermectin, fenbendazole, mebendazole is showing remarkable um, anti-cancer properties because the replication and the reason anti-parasites work is because the replication pathway for a cancer cell to replicate is the same as parasites. So it's the same pathway. So anti-parasite drugs kill parasites and they kill cancer with this utilizing the same pathways. And so I know that Peter McCullough had said that there's actually a clinical trial occurring. They're in phase 2 clinical trials at Cedars-Sinai on triple negative breast cancer, which is one of the most difficult breast cancers to treat because it's highly it changes and it becomes less effective. All of the chemotherapeutics are less effective over time, and they can't seem to find anything that will completely cure or stop triple negative breast cancer. Well, they're using ivermectin and mebendazole in a phase 2 clinical trial at Cedars-Sinai right now, which is really promising that they're in clinical trials because ivermectin's off patent. Nobody's going to make a bunch of money off of it. So the fact that they're actually clinical trials is a huge step. It's huge.
Well, I think that we've reached a point after the first administration and now into this with having RFK Jr. in there and all of the things that are being brought to light in regard to, having gone through after the first administration, going through the COVID stuff, seeing all the evils there, seeing all the problems that were given, and then the subsequent problems from all of the other injections that have been given to people and to kids and everything in the foods, et cetera, et cetera. I think that for the most part, people are starting to become more and more aware and accepting the realities of it and accepting, please help.
Mm-hmm.
And you still have the few who are going to hold back and say, no, this is a load of garbage. It's, Trump BS, et cetera, orange man bad, no matter
Mm-hmm.
how you look at it. And they just will hold on to that. But there are so many things that the government now, I shouldn't say the government now because it's a broad term, but that the present administration and Secretary Kennedy are trying to do, not just in creating alternatives, but creating the awareness.
Mm-hmm.
And that's the key, is
Well,
creating that awareness.
Well, so much was withheld from us, and that's been Bobby Kennedy's whole thing is that I want to give everyone the information so you can make an informed choice. If you want to go out and buy, the crappy food, the ultra processed crappy food, that's your prerogative. We live in a free country, but I want you to at least know what's in it and what that could do to you. So when you make that choice, you're making an informed choice because what's been happening is that we never had any of the information. And back to AI, I think another big game changer was when they announced that at the FDA they have hundreds of thousands of binders of information sitting in warehouses, binders of information, decades of studies and, all that data, and none of it's being utilized. Well, they are downloading it and putting it into AI for analysis. So I think about all of those data points being brought together to try to start to form this huge puzzle be brought into something useful where they're going to grab all of that data and come up with some solutions that maybe we missed because it was sitting in, binder 342 in warehouse G that nobody ever looked at, you know? I don't know. I think it's kind of interesting though that they're utilizing AI to help find the answers.
Well, you have a
Really.
vast knowledge when it comes to alternatives and a lot of things, like even what you were talking about before with folates,
Mhm.
that until the first time we discussed it a few weeks ago, I've been taking vitamins since I was a teenager.
Uh-huh.
Yes, people, they did make vitamins back then. You know, and I've been taking them for decades, and folic acid was one of the things I took.
Uh-huh. 'Cause
And
we didn't
even
we
at
didn't
that
know.
point, you didn't realize the difference in qualities
Mhm.
of these supplements that you're taking, where they're being made, how they're being made, what substances are in them, and how easily they get into your system or not.
Mhm.
And a lot of people, like myself, have been on vitamins for years. And for years, I saw a difference in my health, not getting sick, et cetera, et cetera. But as time went on, I did start to realize that stuff isn't working as well as it used to. What's going on?
Well, the back to that story with the whole glutathione thing, if 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 40 to 70% of the country has a gene mutation that lowers our glutathione, then our ability uh, to break down some of these vitamins into what we call bioavailable state, a state where your body can actually use it. See, if I walk outside and I pick some leafy spinach from my garden and I eat it, I'm getting natural folate. There's there's nothing that my body has to break down in order to use that folate that my brain needs so that I don't end up with Alzheimer's or have migraine headaches or ADD. That folate is gonna help with all kinds of things. But if I just and that's how we used to eat, right? It was fresh, it was real, it wasn't processed, it wasn't tainted in tainted soil with tainted water, all the mess. All the mess, it was just natural folate. But then again, Rockefeller medicine. What he had to do was take everything that was natural, because what he did was like back then, all of the medicine was natural. Doctors knew about nutrition. They treated things like rickets with vitamin D, right? We understood that this disease was caused by this nutritional deficiency. And so if we improve the nutrition, then we can cure this disease. And it wasn't just symptom management, it was curative. Nutrition was curative. And that was the way medicine had been practiced for forever. Rockefeller comes in and he's got to figure out a way to make some money because they broke up his oil conglomerate. Well, what can I do? Well, I can use petroleum to make pharmaceutical products. So that's what he started doing. And because he has so much money and so much power, he says, "Hey, medical schools, we need you to get on board. I'll give you a huge grant if you teach this kind of medicine based on pharmaceuticals versus that kind of medicine." And then went on a smear campaign that all the naturopathic doctors were quacks and that the only real medicine was pharmaceutical medicine made by his petroleum company. And again, we already talked about the fact that he started the American Cancer Society. So he takes something natural like folate from your spinach in your garden. He's got to create, a bastardized fake supplement out of petroleum and call it folic acid. Well, in order for your body to utilize that folic acid that they make in a chemical plant, you need glutathione to break it down in your liver and get it into the bioavailable form. Well, if 40 to 70% of the country can't do that, then we're all nutritionally deficient. The food's deficient, and even if we eat healthy food, we can't break it down. It's crazy. The whole
Now,
thing's crazy.
can you explain to people
Mhm.
exactly
I'll try.
what glutathione is?
Glutathione is the body's master antioxidant. So it clears toxins. That's the big thing. So like in relationship, so I'll do it and talk about it in two ways. Like as an adult, what does that mean? Well, if you don't have enough glutathione, then you have elevated homocysteine levels. Homocysteine levels being elevated lends itself to cardiovascular disease, stroke, neurodegenerative diseases like Alzheimer's, dementia, Parkinson's. And so that's for us as adults. But for these young ones, these infants, these toddlers, these young elementary school kids who are getting these vaccines, if they have this gene mutation, they're getting hit with aluminum and mercury and all of these toxins in the vaccines. They're if they don't have enough glutathione, they can't clear them. So now these toxins are building up, causing an inflammation in their brain, which then we see resulting in autism, ADD, ADHD, behavioral disorders, mood disorders, because it's messing up the gut brain axis, all of it. And so I think that this notion of this gene mutation is actually huge. I knew nothing about it, nothing, until I started researching Tylenol. And so I pay attention to RFK and Trump when they tell us stuff like that. They're telling us what to go look at. And so that's where I go. I go look at that. And what I found interesting is that 6 days after they did the whole Tylenol autism thing, 6 days later on Truth Social, Trump put out a video about the endocannabinoid system. And I'm watching it going, is he trying to tell us that because a lot of people ask, well, if Tylenol isn't safe and ibuprofen isn't safe, then what am I supposed to take if, I have aches and pains and a headache? I think he's trying to tell us. And so again, I know nothing about this because they don't want us to know about this, even in medicine. They don't want me to know about endocannabinoids because if I figure that out, then I don't need as many pharmaceuticals. If I know how to treat the endocannabinoid system, I don't need to take a painkiller. I don't need your SSRI. It's amazing. So I went digging on that. That's what I'm going to do my show on Tuesday. And the only reason I chose to go down and research endocannabinoids is because Trump gave me the heads up. And if you pay close enough attention to him, he's telling us. He's telling us. He continues to tell us. Even his physical, where we're just talking about, the AI enhanced EKG that he got. He's telling us this is what's possible. It's coming. We just have to pay close enough attention to what he's saying, what he's putting out, and then have enough, hey, I should probably take a look at that. I know
Now,
most people aren't going to dig on it like I do, but
because one of the things that's been spoken about a lot in regard to RFK Jr. is methylene blue. Now, is that a form of glutathione, and what makes it so special?
well, I can tell you only that I've done a cursory glance at methylene blue. I've read 2 books on it, and I'll call that the cursory glance, because the books that I read were very highly, positive about it. Uh, here's the only some people say that they get a tremendous amount of effect from methylene blue. My concern out of the gate, and it's probably something I will dig on and present what I learn more, but my only concern coming out of the gate is that it's not natural. This is a chemical created in a lab to dye fabric. And as such, it is not something that God created, God provided. It's not natural. I can't grow that in my backyard. My grandparents certainly were not putting methylene blue into their tea and drinking it. So what I'm trying to do is get back to the more simple. I'm trying to move away from chemicals, not toward them. So if there's a way to achieve the same things that something like methylene blue, which is a nothing more than a chemical, can do, I'm not interested in giving up an SSRI so I can take methylene blue. I'm just giving up one chemical for another. I think what I'd rather do is figure out how I can use something simple like perhaps, you know, full spectrum hemp oil that isn't going to make me high, but actually feeds my endocannabinoid system. That seems more reasonable to me because it's natural. It's something that's growing. It's in nature. God created it. My body has receptors for it. It just seems more um, natural rather than chemical.
Now, are there natural sources of glutathione?
There's ways that you can boost your glutathione. There's things that you can eat, and there's um, uh, essentially you can. There are glutathione even injections. A great resource for this is actually Jenna McCarthy. She had an autistic child, uh, and I don't remember which vaccine it was, but her I think it was her son who seized after one of the vaccines, significantly autistic. And in her quest to try to understand what was happening to her child, she became a very loud advocate for autism. And in a recent video that she put out, she actually put out a video about the whole Tylenol thing, and she talked about the fact that this MTHFR gene, her and her son got tested, and they were both significantly they both had the gene, and they were both significantly low on glutathione, so they actually receive weekly glutathione injections. So there is, and I know that when they put out the information about autism and Tylenol, Dr. Marty McCary, with the FDA, said that they had approved leucovorin, which actually helps autistic children who have a folate, what they call cerebral folate deficiency. Remember, I was telling you, folic acid has to get broken down into folate. Well, they're identifying the fact that there might be an antibody that blocks like the folate receptor on the blood-brain barrier from allowing folate to get into the brain. And so these particular children, there's not enough folate in their brain, and that cerebral folate deficiency lends itself to autism. So it made me think, well, if folate deficiency in the brain can cause autism, could folate deficiency in the brain also cause other neuroinflammatory issues? We've seen at the same time, we've seen autism explode. We've also seen ADD. We've seen Alzheimer's. And there's no cure for Alzheimer's. The numbers just keep going up. They keep doing research. The medications don't do anything to change it or delay it, or the numbers just keep going up. So there's something going on with neuroinflammation in the brain. And I think that there's something to this whole MTHFR gene mutation, folate. There's something to this. And I think that when they did that presser on Tylenol, they gave us just the narrative seeding. More's coming, in my opinion. More is coming. But what they wanted to do was get us doing and talking about exactly what we're talking about right now. That was the whole point of that press conference, was to get people talking and digging and sharing what they're learning. And, so that we'll be ready when the next phase of information comes at us.
I've known for a long time that there are too many people that suffer from anal cranial inversion. I've worked with all too many of them.
Oh,
But
you
when,
almost got me.
but when it comes down to it, I mean, so what you're saying is there really isn't any way naturally to supplement glutathione.
There probably is. I don't know that I dug too far into that. I was just trying to understand the mechanism of this. What lowers glutathione, because it's an antioxidant that is made in your liver, and that, if you have this gene mutation, you're already low in it. So yeah, that would be worthy of additional, research. I'm starting with, I just want to figure out, do I have the gene mutation? They did a homocysteine level and a glutathione level. So I'm more than happy to share my lab results with everybody, because I will be talking about it when I get everything back, just so I can share that with you guys, that, here I am. I've suffered with migraines for, more than 40 years. No, I've had every workup known to man. No, no one can tell me why. I can't figure out if there's a dietary or a barometric pressure, or or hormones. It's random. There's no real cause, and it's a horrible thing to suffer from. I've suffered for years with it. But if it's something as simple as, I might have a gene mutation, so if I just stop eating stuff that has folic acid in it and use what we call methylated vitamins. And all that basically means, when you're looking at something that's methylated or bioactive, those are big fancy words that just mean something your body can use right now. It doesn't have to go through any kind of enzyme process and get broken down into something your body uses. It's ready for your body to use right now. And so folate in a vitamin is ready right now. Folic acid has to go through an enzyme process to break it down. And if you lack things like glutathione, you can't do that. You can't break it down. So then you think, okay, well, what does folate deficiency look like? What does too much folic acid running around in my body look like? It's insane. Throw it in grok, like throw that in and just go digging and look at it. It's kind of amazing how many
And
chronic illnesses are associated just with that one process.
so migraines for 40 years. You've
Yeah.
been married how many years?
I've only been married 7 this
Oh,
time. I've been married a couple times.
I figured maybe that was a contributing factor. But
Yeah, it might be. It might be.
now, quercetin,
Mhm.
I've been told numerous times, has also a natural ability to help other vitamin sources actually get into your system, get past the brain barrier, and be absorbed into your system.
What I
How?
know about quercetin is that quercetin helps, it's what they call a zinc ionophore. And so basically an ionophore is like a piggybacker. So quercetin helps bring zinc into the cell. And why is that important? Because when you bring zinc into the cell of like a virus, you stop the replication of the virus. And that's why at the beginning of COVID, Dr. Zev Zelenko he had identified, Dr. Zelenko, little Jewish doctor up in this little Jewish community in New York, and
Curious
he was
Joel.
yeah, he was trying to figure out how he could help his patients. So he went digging in the NIH website, looking at any information that he could find on SARS, the original SARS virus. Because if this is SARS-CoV-2, then what can I learn from SARS-CoV-1 that maybe I would help with SARS-CoV-2? And what he found was a paper actually co-written by Anthony Fauci himself, that in the laboratory, so they in papers they call that in vitro, that means in the lab. In the lab, in petri dishes, if they added hydroxychloroquine to SARS-CoV-1, it killed it. It stopped the virus from replicating. If it can't replicate, it can't make you sick. Okay. So he was like, Dr. Zelenka was like, well, cool. Let me get hydroxychloroquine and zinc to my people, because the hydroxychloroquine will help pull the zinc, stops the virus from replicating, and we can stop people from getting super, super ill. We may not be able to stop them from getting infected, but I can stop them from getting really, really ill if I keep the viral load down low. And that I do that by stopping the virus from replicating. So he's given all of his patients hydroxychloroquine and zinc, vitamin C, and vitamin D. And he kept all of his patients out of the hospital. All of them were able to stay home, get through their COVID, not end up in the hospital in ICU on a ventilator. So he contacted Mark Meadows, who was the chief of staff for President Trump at the time, and explained to him what he was seeing in his community in New York. Well, Meadows gets that to Trump, and Trump actually did a press conference about this doctor, didn't name him, but said, I've been contacted by a doctor who's using hydroxychloroquine. And that's when President Trump actually announced that he himself was taking hydroxychloroquine as a preventative for COVID. And they also announced in that first term that they were stockpiling hydroxychloroquine for use for the public. But then there was that whole campaign that hydroxychloroquine was cardiotoxic, which is such bullshit. What I can tell you is that chloroquine is cardiotoxic. And I know this because I saw it firsthand in my own practice. I was a fairly new nurse, had a 17-year-old young lady come into the emergency room, and she was completely unresponsive. And her boyfriend had taken her to like an urgent care center. They said, oh, we got to send you to the ER. So she comes into our ER. At this point, it's like 9 or 10 o'clock in the morning on a Saturday. And we ran every test. We're doing CAT scans. We're doing drug screens. We're doing every test known to man. We can't figure out why this girl's not responding. Still breathing on her own. Blood pressure's okay, but she is not responding neurologically at all. We send the boyfriend home. We tell him, go look for anything out of the ordinary, anything. Come back and let us know if you find anything. He comes back with this empty glass mason jar, and it has this white film on the inside of the jar. He said, all of my chloroquine is missing, and I found this. We're like, why are you taking chloroquine? Well, he had recently traveled to visit family in Africa, so he was taking chloroquine as an anti-malaria prophylaxis. Well, what she had done was taken all of that chloroquine and dissolved it in water and drank it. That was the film that was in the mason jar. It was the first and only time in my entire career that I called the Poison Control Center, told them what we had. This is what we think she took. This is the time frame. She's this old. She weighs this much. And what I got back from Poison Control, only time it's ever happened in my career, they said, oh no. I said, what do you mean, oh no? You guys are supposed to tell us what we need to do. What do you mean, oh no? Well, with the time frame, it's too late for us to intervene. She's going to have this cardiac arrhythmia, and then she's going to die because none of the measures that you will attempt will work. And I was like, what? Because it's cardiotoxic. It had been too long for us to do anything to be able to stop the course of events. And she did eventually go into cardiac arrest and die. So what did they do with chloroquine? Chloroquine was used to treat malaria even in like World War II. And but again, it has this cardiotoxicity, and what it does is it makes the ventricle part of your heart actually have some arrhythmias, beat funny. And so they tweaked it and they added a hydroxy molecule to it, which stabilized that. And so now we see hydroxychloroquine used very safely over millions of times for things like lupus or rheumatoid arthritis. It is safe to give to children. It is safe to give to pregnant women. You had said backstage that your wife has taken hydroxychloroquine for decades, right?
25 years. And the only thing that she has to do is have a field of vision test for possibility of color blindness.
Yep. So safe, no cardiotoxicity with hydroxychloroquine. But what we saw was a media campaign funded by the companies pushing vaccines that this is dangerous. You should not take this. This is dangerous. And then you started to see states banning it. So that's what happened to Dr. Zelenko. New York banned the use and sale of hydroxychloroquine. So then he's like, okay, what do I do now? So he went digging. If hydroxychloroquine, if the way that it works is that it brings zinc into the cell, what other things work like that? And he discovered quercetin, which comes from like the seeds of like grapes. And quercetin, although not quite as effective as hydroxychloroquine, would still help bring zinc into the cell. So he started putting everybody on quercetin. Quercetin with zinc, vitamin D, vitamin C, and he was still getting the same results. So that's where quercetin came into the game with COVID. It was Dr. Zelenko. God rest his soul. That man was a warrior. He was a warrior.
Yes, he was.
He helped wake me up, and I learned all about single-strand RNA viruses and how they replicate and what works and what doesn't from that man. And when he started talking about the fact that this protocol that he had come up with that was working against SARS-CoV-2 would work on all single-strand RNA viruses, and you start like, okay, well, what are those? Well, the common cold, the flu, Marburg virus, dengue virus, Zika virus, HIV, all single-strand RNA viruses. You remember when they were coming out with the whole monkeypox virus thing? Guess what? Single-strand RNA virus. You take quercetin and zinc, vitamin C and vitamin D, all natural things. And you can stop the replication of the virus.
Isn't Legionnaires also single strand?
I'm not sure. I'd have to look that one up. I don't know. But there was like this a whole butt ton of them. They were all single-strand RNA viruses. I said, isn't that interesting? Here we are, like losing our minds. You've got to get a vaccine for this virus. No, you don't. No, you don't. There's a difference between infection and illness. And it's really difficult to stop viral infection. But you can stop viral illness because illness is based on viral load. So if I sneeze on you, you're going to get infected with my cold. But whether or not that infection results in you getting a sore throat and your nose all snotty up, and then, the cough and the congestion and feeling like crap and laying on the couch under a blanket, sick as a dog for several days, the difference between my sneezing on you and you laying on the couch under the blanket is viral load. That's it. So if you can stop that virus from replicating at the moment that you're aware that you're infected, and usually that happens, it's called the prodromal phase, PRODROMAL. So we'll go back through our scenario. I sneeze on you. I'm infected with a cold. I sneeze on you. Day one, you're not feeling anything. Day 2, probably not. Day 3, usually it's about 5 days incubation period. By day 5 of your now infection, you start to feel icky. And it feels different for everybody, but everybody knows exactly what I'm talking about. That feeling like I'm coming down with something. For me, I feel kind of weird and full, like here and in my ears. My throat feels a little scratchy. I feel just kind of a little icky, but I'm not sneezing. I'm not blowing my nose. I'm not snotty or coughing yet. I just feel icky. If you intervene right then and there and stop that virus from replicating, you never have to get sick. How do I know that? Because I haven't had a cold in 5 years. Because I've done exactly that for the last 5 years. As soon as I get prodromal, first of all, I take vitamin D, I take vitamin C, and I take zinc every single day. But if I start to feel icky, I start hydroxychloroquine and I start ivermectin. And within 3 days, I'm usually off of both and I never get sick because they stop the
Also,
virus from replicating.
just interrupt you there.
Uh-huh.
Because we had this discussion too, and it comes down to what we were talking about before with the qualities.
Uh-huh.
There are particular vitamin D3s that are much, much, much more beneficial than others. And combining that, you had also said, with folate.
With vitamin K2, with vitamin D. So, vitamin D at high levels, pretty much everybody is vitamin D deficient because we spend so much time indoors. And even in the summertime, um, and you're outside in the sun, if you're over the age of 50, most of, we make vitamin D from a reaction to the sun and our skin. But if we're over the age of 50, we don't make vitamin D from the sun the way that we did when we were 20. And so, eh, we need to be supplementing if we're over the age of 50. If you're spending most of your time indoors and you're not getting any sunlight, you need to be. And then, of course, you think you're eating healthy, but the soil's depleted of all the micronutrients. So you're not getting the good stuff from the soil. So we probably should be supplementing. When I learned about vitamin D from Dr. Zelenko, I went and had a vitamin D level drawn. And I considered myself fairly healthy and I'm outside all the time as much as I can be. And my vitamin D level was in the 30s, which was really low. So I started taking vitamin D3 and got my vitamin D level up. But I also learned in the process that vitamin K2, what vitamin D can sometimes do is it can leach calcium out of your bone. And so as your vitamin D levels start to come up to a more appropriate level for your immune system to be able to function properly, it can leach calcium out of the bone. If you take vitamin D3 with vitamin K2, the K2 keeps the calcium in the bone. So I'm taking, because my vitamin D level was so low, I was taking 10,000 units of vitamin D a day. And then I went back and had my vitamin D level drawn, and I'd gotten it from the 30s to the 80s. So I kept taking vitamin D at 10,000 units a day because I wanted to get it up over 100. My goal was to get it to 125. Why? Because there's a lot of evidence out there that vitamin D levels above 125, now you're starting to get into a level where it's actually anti-cancer. Dr. Paul Merrick wrote a book on cancer care, and he devoted an entire chapter on vitamin D and its role in cancer care. So I'm trying to get my vitamin D level at least above 100. So I got my vitamin D level up to 128, and my doctor called me in a panic. In a panic. Oh my God, your vitamin D toxic. I said, no, I'm not. He said, your vitamin D level is 128. I said, stop looking at the numbers. First of all, do you have any idea where those numbers come from? No. And you don't even know who made them? No. So, doctor, if I were vitamin D, and this is exactly how I talked to him, because I just do. Okay, doctor, if I'm vitamin D toxic, how would you know that? If you were not looking at that lab value and you were looking at me or any other lab value, what how would you know I was vitamin D toxic? And there was silence on the phone because he's calling me with this, this emergency toxic level of vitamin D. Because normal for most labs is 80 to 100. So because I was 128, he's freaking out. And I said, "Well, doctor, wouldn't you expect that if I was toxic with vitamin D that my calcium level would be really high? Because isn't your concern with the really high vitamin D level that I would have too much calcium in my bloodstream and that calcium would then start causing atherosclerotic plaques to form on my arteries? Isn't that your concern with vitamin D toxicity?" He said, "Yes." I said, "What's my calcium level, doctor?" "Well, it's normal." And I said, "Uh-huh. Do you have any idea why?" Silence again. I said, "Because I take vitamin K2 with my vitamin D, sir. That's why my calcium level is normal and my vitamin D level is exactly where I want it. Thank you for your concern. I'll handle it from here." The problem is, and RFK has put this out there and they're making the changes. It's not I don't want to bash doctors because they are a product of their training, just like I was a product of my training. I know this right now, not because of anything I learned in school, in my degree, not anything that I learned on the job train, none of it. I know this because I looked at this. That's it. If I can do this, you can do this. Anybody watching us tonight can learn what I learned. I Being a nurse has nothing to do with that particular knowledge. I looked it up and read a book. And so anyway, um, the doctors are not receiving any nutrition training because it goes back to that Rockefeller model. Rockefeller didn't want doctors to know about nutrition. He wanted doctors to know about pharmaceuticals so he could make money. That's it. So they stopped teaching doctors anything about nutrition. So if you go to your doctor expecting him to be able to have a conversation with you or teach you or guide you or consult you, they can't because they don't know. They just don't know because they were never trained. And so, you know, it's at the point now where I see the nurse practitioner, and every time I go in to see her, she brings a notebook in and she's like, "So what are you going to teach me today?" So when when I was there last week, I was teaching her about MTHFR and the whole folic acid thing. She said, "I had no idea." I said, "I know, me either. We don't know. We're medical professionals and we don't know. So you guys can't expect us to help guide you in this. I'm here to tell you you've got to do it yourself. You're going to have to do it yourself until things change." And RFK's trying. They're going to be changing medical school curriculum. Now, first year medical students are going to have to take nutrition courses in order for them to get the certifications for the colleges. Huge step. Just getting the doctors some education in this will help them help us. But in the meantime, we got to do it ourselves because you ask a nurse, she doesn't know. You ask the doctor, he doesn't know. We don't know because we were never trained.
See, now two questions along that line. You've got the vitamin D issue. And in a lot of older women, they tend to be vitamin D deficient and also have problems with bone density. And what doctors will tend to do is prescribe prescription strength vitamin D,
Mhm. It's vitamin D,
50,000 milligrams.
vitamin D2.
Right.
And it's not as readily absorbed as vitamin D3 based on what I've read about vitamin D. It's less bioavailable.
Well, and the
There's
other
some
part of it,
issues there's some issues with vitamin D as well that I haven't researched enough. It was brought to me by a viewer actually of my show who said, "Hey, I'm learning about some issues with synthetic vitamin D." Could you look into it? And it's on my list of things. I have a whole like sheet of things that I have way too many things to research and not enough time because I'm still working full time. I can only do
Well,
one topic at a time.
but the other part about that is the fact that aside from the fact that vitamin D2 as opposed to vitamin D3,
Mhm.
it is a prescription medication,
That they
thus
make
in
money.
turn a chemical
They make money on it.
reproduction. So
They
people are much better off having natural vitamin D3,
Mhm.
taking the vitamin K2
And
than
then you
they
have
are
and
taking the
then
pill.
you have to do a little research, but again, I'm gonna keep reiterating the AI because it makes it easier for us to research. It makes it easy. And Grok will talk to you in language that you can understand. So, um, supplements have been taken over by pharmaceutical companies. If you walk into any Walgreens or any CVS or Safeway or whatever your local grocery store is, um, the vitamins that are available at that store, 99% of them are owned by pharmaceutical companies. And so, for instance, you're taking a multivitamin. If you turn that bottle around, Nature Made or One a Day or Centrum Silver or any of those vitamins, and you turn that bottle over, most of what you're seeing on there is not bioavailable to you. Your body can't use it. It needs to break it down. It's definitely going to have folic acid instead of folate, right? So, what vitamin companies are better than others? So that was one of the questions that I threw into AI when I was doing research on supplements, right? Which companies are the better companies? Which companies source more naturally? Which companies are based in the United States? Which companies are not owned by pharmaceutical companies? And what I found out was that there was like these top 4. Some of them are more expensive, like Thorne is a really super expensive brand. Um, Life Extension has a decent um, portfolio. The one that was the most highly recommended was Now, NOW. It's a family-owned brand. They do all of their own quality testing, and then they also third-party test. And I can tell you that, one of the supplements that I found in my quest for supplementation was a proteolytic enzyme called nattokinase. And nattokinase is really good for inflammation. It's got a natural source, and it actually helps lower blood pressure, and it actually acts as a natural anticoagulant as well. So you would want to be careful taking nattokinase supplement if you're on something like a blood thinner, like Eliquis or Plavix. But for general folks, it wouldn't cause any increased risk of bleeding unless you're chomping down aspirin on top of it. But, what I found was, like, when I was trying to get nattokinase and use nattokinase, I found it out of stock a lot at the Now brand. So I called their 1-800 number, and I was curious why it keeps going out of stock. And what's interesting about the company is at any point in time, you can pick up the phone and ask to talk to a nutritionist, and they'll put a nutritionist on the phone with you and talk to you about your supplements, which I find that's fabulous. But what she explained when I got her on the phone was that because their quality control is so stringent, if they can't find the quality of the sourcing that they need to make that supplement, they will put it out of stock until they can source it. They will just put it out. They're not going to lower their quality in order to put out a product because the quality to them is more important than quantity. And I was like, "You guys are my fave." And most of the supplements I take is from the Now brand. I am looking at another source right now. I'm in the process of doing some research, but when I know more, I will let you guys know. But the whole thing about you want it to be quality sourced. You don't want it to be, a pharmaceutical company is going to cut corners and use the cheapest alternatives, the lowest quality. They're not going to third party test it for heavy metals or any of those other things. Go with the quality. And Now is not now is very reasonably priced on the scale of supplements. So yeah, that's the one I use currently. I took now vitamins tonight with dinner. So yeah.
See, in the second half of that question is you've been in the medical field long enough that you would remember when you walked into a doctor's office before, you know, pharmaceuticals were as big as they are now. They always had that big book on their desk, the old PDR.
Yep.
And anytime they prescribed a medication, go through the PDR and look it up and tell you what possible side effects there were, et cetera, et cetera. Now, for all intents and purposes, again, your PDR is right here. And these guys don't know squat other than what the sales rep tells them
Hmm.
in regard to any of these medications. And for the most part, because of, again, what Big Pharma and the corporations have done with the pharmacies, the pharmacist, who's the only one who really does know anything about these drugs, doesn't have the time to sit with a
What
customer.
even a doctor doesn't have the time. In order for them to hit again because of corporate takeover of medicine in our country. It's been a corporate takeover. We are not in healthcare anymore. We are in corporate medicine. And so these doctors they have to hit quotas, they have to see so many patients, for a doctor to sit in a doctor's office and spend 45 minutes with you on an annual exam is unheard of anymore. They come in and it's take a deep breath, take a deep breath. Let me bang on your knee. Okay, I'm going to do this blood test, this blood test, this blood test. Do you need any refills? Okay, see you next year. That's the extent of an annual exam today because that's all they have time for. And so, when you're on 15 prescription medications and each one of them has an average of 22 potential adverse symptoms, and this one might interact with this one and create this issue, and then you need another medicine to deal with that symptom. There's no way any one practitioner could keep track of all of those potential side effects and be able to give you quality information on all those drugs. There's no way. They don't have the time. And as a result of that happening, I think over year after year after year after year, what they've done is beaten out of doctors the desire to even want to know. They're just a cog in a wheel in a machine to keep it going, to keep it going. And, because I saw it even last week, I personally saw it when I asked physicians that I worked with, did you guys see the Tylenol autism press? Yeah, yeah, yeah. What did you think about that? Yeah, really weird about Tylenol, right? Yeah. Did it, did it make you curious at all? Did you look it up? Because in your discharge instructions that I'm going to hand to patients today, it says take Tylenol. Did you guys look it up at all? And the answer was no. No curiosity. The answer was no. We didn't.
Yep.
And I think it's been beaten out of them. I really do. I think it's been beaten out of them because I watched it and I went, huh, Tylenol. I should probably look that up. Since I give Tylenol every day, I might want to look that up.
But this
And
is all stuff that, again, time-wise,
mhm.
interest-wise, they don't, when you're no longer
They're
the
not
owner
prac
of your practice.
they're not practicing medicine
No,
anymore. They used to practice medicine, and that's an art. It was an art form. That connection with the patient, and they simply cannot. It's been beaten out of them by
but
this corporate model. I can't blame the doctors. I really can't. I'm frustrated by the whole system. I'm frustrated, but I can't really blame the doctors. Now, there are some doctors, don't get me wrong, there are some doctors that are out to make as much money as they can make. That is clear. But I don't think that's all of the doctors. And most of the doctors that I work with are not that kind of doctor. But I think it's just been beaten out of them by a corporate system that completely beats it out of them. And I'll tell you something else that I've noticed. When I got trained as a nurse, I was trained, and the team that I worked with was a very collaborative team, and they really fostered this whole critical thinking in me as this brand new newbie young nurse, right? They would ask me questions like, and this was before I even finished school. I'm working as a tech in the ER, and the nurses would ask me, "Hey, um, do you see the color of the urine in that Foley catheter over there?" Yeah. Okay. Well, that patient came in with a head injury from an auto accident last night. What do you think might be going on? And I'm going, uh, I don't know. Okay, well, you're going to go look that up tonight, and you're going to come into work a half an hour early tomorrow and explain it to everybody, because it's important that you know that. And that's how I was trained. They fostered this critical thinking. When I look at observationally, when I see something, what is happening pathophysiologically with my patient, and then how can I take measures to offset that? Follow it all the way through. So anyway, that's been beaten out of nurses with this corporate medical system. What they want are nurses that have a bunch of advanced degrees from institutions that have beat out of them any notion of critical thought. It's a bunch of theoretical, useless crap, but you've got all the letters behind your name. So we can say all of our nurses are masters prepared. Well, well, good for you. You have no idea what to do with the patient in front of you, because all you know is theory. They don't know what to do right here. They don't want nurses who critically think. They want nurses who do as they're told. So here's what I can tell you as an insider. When you have residents, so a doctor goes to medical school for 4 years, and then he's going to go into his specialty, and so he's going to do a residency program, and that can be varying number of years, and then you can go on for additional training if you're getting super specialized. So when doctors finish medical school, they haven't touched patients, they haven't had any hands-on, and they're thrust into hospitals to begin their residency training. In the almost 35 years of being a nurse, residents are really dangerous because they don't know. They've been through school, but they don't know what they're doing yet. And so nurses save their behinds a lot. No, you don't want to do it that way, doc. Do it this way. So when you have residency training programs in hospitals, it is vitally important that that hospital is staffed with a bunch of critically thinking nurses who can offset these residents as they're learning. But that's not the case anymore. They don't want nurses that critically think. They want nurses that just do as they're told. Well, how dangerous is it that a nurse doesn't question an order from a resident who's brand new? Who suffers in that process? The patient. Because nobody's looking out for the patient.
Well, just as
Nobody.
upset as I was when my business started using daily hire employees, the 2 times that I was in the hospital, I learned the sad news that many of the nurses are on provisional contracts
Yeah, they
for
call them
X amount of months.
agency nurses. Yep. Hmm.
So you could be in the hospital for, a couple of weeks, and the nurse who is doing a really great job taking care of you, you know, sorry, this is my last day. I'm leaving here and going to Seattle because I got
Hmm.
a contract.
Hmm.
And you have to look again and say, what the hell are they doing?
Well,
And it's
they've
because
absolutely, and they can't keep nurses. They can't keep nurses because
they
of
don't want to pay.
patient ratios. They don't. Here's what I can tell you, that when a hospital is looking at a budget, because I did budgets for a little bit, and if it's budget time and they tell me, hey, you need to cut X% off your budget, well, I'm not going to cut supplies, and I'm not going to cut contracts on my equipment because I need to make sure the equipment's working. Where am I going to cut? What's the biggest percentage of any hospital budget? The largest percentage is payroll for nurses. And so if they can cut 0.5% off of the pay of the nurses at that hospital, boom, they just hit their budget um goal for that year by cutting the nurses' salaries. And so that's what they'll do, because the nurses are the largest personnel in any hospital. And so it's the first one that they'll cut. They also will cut nursing education. So ongoing opportunities for nurses to continue to learn and get additional training. They'll cut nursing education right out of the gate if they have to do budgetary cuts. It's the nurses and the nurse educators. They'll cut out middle management. And so you'll have one manager managing multiple units. So you're never really keeping an eye on how things are going. The whole system is a mess. It's a mess. All of it.
And this is what's keeping us alive.
Yeah. And, and it's sad because, it certainly isn't what it was when I entered the field. It used to be a field that was a trusted career, it was a career that I was proud to be a part of. I was a career that I flourished in, and it is not that anymore. It is not that anymore. And I think one of the most difficult things, and I see it in my chat of every show, there's medical professionals that are in the chat of my show. And the saddest thing is when I hear from them their frustration that I can't do this anymore. I can't be aware of the matrix and continue to work in the matrix. I can't have any integrity and continue to be a cog in this wheel, a puppet being utilized by puppet masters to potentially harm people for profit. I can't do this anymore. It's not what nurses went into the field to do, and yet we're being forced into that position. It's all profit driven, profit, profit, profit. And that's not what we went into it for. We went into it because it was a caring profession. We went into it because we wanted to be advocates for better health, for improved quality of life. And we can't do that anymore. We can't do that anymore. I can't tell you the truth. I can't tell you the truth in my job. I am forced to lie every single day. I can't tell you, hey, you might not want to be taking that cholesterol medicine. I can't say that. I just have to go, oh, so you're 28 years old and you're on a cholesterol lowering medicine? Did you look that up? Did your doctor talk to you about the fact that that might actually, long term lead to neurodegenerative issues? Or, the woman who weighs 158 pounds, 5'8", and she's on Ozempic, and she's in my surgery center having her gallbladder taken out. Did anyone tell you that Ozempic can cause gallbladder disease? No. But that's not a question I can ask, because patients aren't supposed to understand what's happening to them. We're just supposed to do the procedures. We're just supposed to give the medicines. That's all. That's what they expect of us. And anything outside of that, you're a troublemaker.
Yep.
So
Been there, done that.
I'm a bit of a troublemaker.
wonder why we get along so well.
I'm okay with it. I'm okay with it because I'm standing on the truth and I give the results to God. I'm okay with it. I'm going to tell the truth. The truth is more important to me than anything at this point because we have been lied to about so many things on so many levels, on so many topics. I'm not playing that game anymore. I'm going to tell the truth.
Shall set you free. And like I've said a bunch of times recently to a bunch of people, eventually you're going to take that last breath. And when you get up there, how are you going to explain yourself?
I want to hear, well done, good and faithful servant. That's what I want to hear.
Yep.
I want to hear that thank you for standing up. Thank you for your courage. That's what I want to hear. I want to do the right thing because it's the right thing to do. And come what may, the consequences. Yeah.
Well, we could go on with this for hours, but
We could.
we're already past 2:15 already. Been a great discussion.
It has. Thank
Yeah.
you.
People, you want to tune into a great show, catch BB on Tuesday nights at 8
5
p.m.
p.m. 5 p.m.
Oh, 5 p.m.
5 p.m. on Tuesdays over on Rumble, Doses of Deception. And this Tuesday, we are diving into the endocannabinoid system. And the only reason I'm doing this is because Donald Trump put that video out about the endocannabinoid system. And I don't know anything about it because it's just kind of been, it's an entire biological system in our bodies that's just been negated by all of the medical curricula. Well, I want to know why. I want to know why. And how maybe could that help us be less dependent on big pharma? So join me 5 o'clock on Tuesday.
And they can catch you on X also.
Yes.
So absolutely, positively worthwhile. Everybody,
Thank you.
follow
Thank you,
BB
Mark.
wherever you can find her.
Thank you,
So,
Mark.
thank you. Thank you. And, just to wrap things up for everybody, your little housekeeping here, that little QR code that you see in the upper right-hand corner. I'm still sponsoring the guy because I believe in him. If you want to contribute to Louis Herm's campaign for governor of California, click on that and do what you can. He's a real guy and he's a real humanitarian and kind of fits another non-politician that I know. But it'd be a good thing to get him in. And then, of course, my favorite thing, if you can donate, if you find it in your heart to donate for the ARC training, which will help to train people how to recognize, rescue, and rehabilitate trafficked children.
Oh,
This
yeah.
is a worthwhile cause.
Yeah.
Matter of fact, probably next week I will be revealing something new, something I've never done before, but it's going to help this campaign a lot.
Oh, good.
So we're going to try to keep that going. Of course, coming up on Tuesday night after BB's show at 8 p.m. Eastern, Kat will be back with episode 14 of Back to Light.
Yay.
Which will be a great show to watch. So that comes on Tuesday at 8 p.m. I know it's a week late, but hey, things happen. And then the other thing, that's all the housekeeping. The other absolutely important thing, of course, let's thank Claudia, Kat, Carrie, and Doug, who are absolutely the best crew that anybody can ever have doing this. Because without them, I ain't nothing. So once again, I want to thank you all for tuning in. BB, thank you. This has been absolutely inspiring. Everybody, have a fantastic week. Be your own advocate.
Yes.
If you can stay away from doctors and if you can stay away from pharmaceuticals, do it. Pick this damn thing up and stop playing Kings, whatever it is that they keep advertising on TV. Look up something that's important instead of Facebook. So everybody have a wonderful week.
Have a great week, everyone.
Stay well, and we will see you next week for another respect. Good night, everybody.
Good night.